So Luscii is a remote monitoring company which has done over 350 implementations of remote monitoring in 11 countries. And we're now owned by Omron, which is a global device company. So what we do is we offer remote monitoring services, and what we mean by that is we collect information from our patients, and then we essentially prioritise and filter that information so that the doctors and the nurses can essentially focus on the patients who need their care at that moment, and then we communicate back to the patients telling them what should happen as a result of the information we've got. And that might be communication through the app, or it might be communication through the phone or a video call. And we use that across the whole continuum of care, in virtual wards to get people out of hospitals, around long-term condition management to keep people well, and in primary care. So what we're trying to do is we're trying to have a single app which allows our patients to operate across the whole care continuum. And we have something like 30 evaluations which show how effective we've been.
As Jonathan was rightly saying there, I think it falls into all patients should be our customers. We work, obviously virtual wards has been where a lot of the money was filtered recently, and that's a nice way for a filter to occur and for a sort of an initial strategy around virtual wards and remote monitoring. But the true scale is delivered when you monitor that patient from start to end. Whether they are recovering from an acute episode and then they want to be discharged and then looked after by primary care or community services, or whether or not you're actually trying to head them off before they even get into hospital, so referring to alternative care pathways and modules of that nature, so working closely with the ambulance teams, the acute, community, primary care. At the end of the day, we're all trying to be an integrated care system, but sort of Luscii, we see ourselves as that digital bridge between those different networks, because I think there is a lot of fragmentation still occurring in the system, and for MDTs to operate effectively, they need that information shared in one place, and that is very much how we work.
Essentially because nurses make the NHS work to a large extent, they deliver a huge amount of care, and they are crucial to the outcomes for patients. And as everyone, and as you will particularly know, there's a huge pressure on nurses. I think the average age of a district nurse in the NHS is something like 54. So you've got huge increases in demand, you've got very constrained capacity, you've got an ageing workforce, and we need to help nurses as much as we possibly can to look after their patients as well as they can without burning out and facing all the other issues that many nurses face.
This is, as we say, it's the coalface. Some of this virtual wards, we put new words around them, but nurses have been doing this for a very long time. They've been reaching out, they've been working in community, they've been working in difficult situations. They know what the patients need. They are right there in that space. Sometimes there could be a detachment between when you get more senior, you start to get further and further away from what is actually occurring on that coalface. Working closely with the nurses, I've seen very much so empowering them to handle the wider caseloads, a plethora of healthcare problems that they would normally sometimes get a bit codified. We've seen them working now in virtual ward space where they're now undertaking multiple areas. And then we're watching these nursing teams driving organisational change. And that to me is one of the reasons why really coming here, because I've watched nurses who have gone from they call themselves, I'm just a nurse, and then actually they're being put in political situations where they're making real change for an institution, sometimes without a lot of support, having to really fight that. So I think the more we can do to support the nursing teams, the better, because they really are the ones that are actually there making all the difference.
What our customers would say about us is we're a good long-term partner, because what everyone knows is changing the NHS takes a long time, and it's a technology partner has no use if we come along, we sell you a bit of technology and then we disappear. We're in it basically for the long term, and that's why it's so helpful that we're owned by Omron, which is essentially a large global company, because we can commit to make a long-term difference. And we think, and our customers will tell you that that's something that really sets us apart.